Welcome to the Anterior Abdominal Wall and Inguinal Canal whiteboard walkthrough series. This series has kind of a strange order, but it's very deliberate so that we can build up knowledge to fully understand what we're looking at, so let's jump right in. Okay, so I feel like the inguinal canal is just confusing for no reason, and I want to clear that up today. So inguinal canal, we're talking like if this is the hip down to, let's say there's ambiguous genitalia, you got a belly button here. So that's kind of where we're at. And what you're gonna see once skin is off, so we took off skin and then we took off Camper's fascia, which is your subcutaneous tissue. So if we make a little chart on the side, we have first layer. If we're going from superficial, most superficial, like this is the external environment, to deep or deepest, however you want to think about it, like inside the body, most likely. Let's put in our layers as we go. So this is skin, right? Most external. And then the layer deeper is your subcutaneous tissue, which is your Camper's fascia in the abdominal region. Camper's fascia is just subcutaneous tissue, is just hypodermis in this region. Think of if you're a camper and you have to stay warm, you need some more subcutaneous tissue to do that. So that's Camper's fascia, next layer down. And we're removing Camper's fascia. So Camper's fascia will go away. It's just loose connective tissue. It's mostly adipose. So we're looking at something like this, adipose and cutaneous veins and nerves. Next layer down. So these are the ones we're removing, so I'm not doing anything over here. Next layer down is a fascia that is thicker, dense connective tissue. It's going to be kind of white, very thin layer. It's going to blend with the tendons or what's called aponeuroses of your oblique muscles. This is Scarpa's fascia, also getting mostly peeled off. So these first three layers are going to be gone in your dissection. We took them off. We kept the belly button, like a piece of skin that's still attached somehow, and we'll see how in a second. And then we have removed all the skin. So what do we actually see once we remove all the skin? Well, we start to see our abdominal muscle. So we're going to see the muscle goes pretty high up, to be honest, on both sides. What is that muscle? This would be our external oblique. It's going to be the most superficial muscle we see is going to be the external oblique. It's going to kind of go up to what I would call the costal margin. That's the bottom of your rib cage where your costal cartilage is. You can feel that. You can kind of palpate where your ribs are. The margin, the edge of your ribs. In the middle, it's going to be your xiphoid process. Now, we wouldn't be able to see xiphoid process for real, but I'm going to put it on there. Okay, so that's kind of our upper margin. Our lower margin has everything to do with our pelvis. So when you get to abdomen, you really get to pelvis because the false pelvis, which you'll learn about later, is abdominal contents. So some of the stuff that spills into our pelvic girdle, the bones of our pelvis, are abdominal contents because they are. And so the pelvic bones are going to come into play here. So I'm just going to give you a quick pelvic anatomy. The pelvis is made up of two os coxa, which are essentially your hip bone that articulate with themselves, and then also in the back with the sacrum, which is a part of your spine. It's the lower portion. Your coccyx is your tailbone, but it doesn't matter for us right now, so we're going to ignore it. We're going to focus on those os coxa, of which there are two. The os coxa themselves are actually made up of three fused bones, and we still talk about those bones as if they are separate in anatomy. So the most superior portion of your pelvis, highlighted in yellow, is the ilium. The most anterior portion that articulates with the other os coxa is the pubis. The inferior most portion that is difficult to really see in this view is the ischium, and that portion is what you feel when you sit on your hands. And that's enough of a pelvic overview that we will understand the next few attachment points I talk about. This sort of ambiguous genitalia area, I haven't chosen sex or anything because it's irrelevant to this for the most part, is where we would have our mons pubis. It doesn't matter who you are, you have a mons pubis. It's just a mound of subcutaneous tissue over the pubic symphysis. So the pubic symphysis is right here in the middle, which means the pubis is here too. So this is under the skin, but we can see our pubic symphysis. We can see our pubis, which is this angled bone. So the pubis is really an angle, and it's fused with two other bones that make up the pelvis. So this is our pubis, is really these two portions. We have a superior ramus and an inferior ramus. We don't really care about the superior inferior ramus. What we do care about, though, is the bump that's on sort of the top, the superior portion of our pubis, and it's called the pubic tubercle. And the pubic tubercle, which is about here, let's say, is going to be an attachment point for a lot of stuff in the anterior abdominal wall. So pubic tubercle is a bump you need to know that's on the pubis. And then we need to know about this line. There's going to be a ridge that kind of goes posteriorly, and that ridge is called the pectineal line, or the pecten pubis. And that ridge is another landmark for you for attachment, specifically with the inguinal canal, because that's kind of where we're going with this stuff. First thing you need to know is that. Now I do have to draw in the rest of the hip, and I don't think I can do it accurately. So let's just try, shall we? What we need to see in this is this portion, which is called the ilium. The ischium is essentially like the back of your pelvis, inferior. When you sit on your hands and somebody's really bony, you're feeling their ischium. You're actually feeling their ischial tuberosity, but that's getting too far into pelvis. Ischium is the other bone, but it's not really here. It's kind of here and behind. And then your femur would come in like this, articulate right there. But what we need to see is this bump. There's two bumps. One is above, one is below. The one above is called our anterior superior iliac spine, because this is the ilium. The part with the big wings is the ilium. So this is my anterior superior iliac spine. A spine is a very sharp little bump. A tubercle is a little less sharp. That's the difference. You've seen the spines of your vertebra. They're very sharp. So anterior superior iliac spine, you can probably guess the lower one is the anterior inferior iliac spine. This one we know as ASIS. Probably already heard that a couple times while you've been learning. And this one is the AIIS. We don't really care about the AIIS today. We care much more about the ASIS. And I'm going to teach you how to find it on anybody. You're going to feel for the soft part of your body below that costal margin. So you find your ribs, go below that. There's not a lot of space between. I have a very short torso, but you're going to feel for that softer part, and you're going to push down with your thumbs. And you're going to run into, at some point, the tops of your ilium, which is called the iliac crest. Think like a crest or a crown. So you've run into the iliac crest. Now go forwards along the crest, and you should find a little bump. That's your ASIS. The ASIS is a findable structure. Some people, you can see their ASIS if they're very, very thin. So you can find that ASIS, and why I'm talking so much about it is because there is a ligament here. And this ligament has everything to do with what we're about to talk about. There's a ligament that runs from the ASIS, bone to bone, because it's a ligament, to the pubic tubercle. ASIS to pubic tubercle. What ligament is that? It's your inguinal ligament. So this is my inguinal ligament. That is the floor of my inguinal canal. Because these are bones, this is very, very deep. So the inguinal ligament is inside, bone to bone. Very, very deep. What we call the floor of our inguinal canal. Now, what I mean by floor is when we imagine the inguinal canal, I want us to imagine a tunnel. And that tunnel has an opening on both sides, like so. And that tunnel is going to have a floor, a bottom, essentially, where the car would drive. If this was a real tunnel, this is the part that has the road on it, okay? Like the lines of the road. Hopefully that makes sense. Where the little car would drive through the tunnel. So the inguinal canal is a lot like a tunnel. And the inguinal ligament, this guy, is the floor of that tunnel. We're going to get into the weird thing the inguinal ligament does and why you have to learn two other words right now. So when the inguinal ligament starts the ASIS, it attaches to the pubic tubercle, I said, that bump on the pubis. When it attaches to the pubic tubercle, so at the opening, which is called our superficial inguinal ring, so at our superficial inguinal ring, the opening to where? To the perineum. It's not really like it opens and comes out of your body through your skin. That would be horrifying. But the opening is under the skin, but very superficial. It's right underneath that subcutaneous tissue, this opening. So when you dissect, you absolutely see the opening of your superficial inguinal ring, and I'll teach you how to find it. But the floor is that inguinal ligament, and that inguinal ligament, when it reaches the pubic tubercle fans out. So like the fibers, the connective tissue that make up the inguinal ligament, they fan out in a sort of pseudo triangular shape. So when we get here, it actually fans out as it attaches to that pubic tubercle. This is on the pubic tubercle that our inguinal ligament is fanning out. That fanned out portion at the entrance has a name. So I'm going to draw yet another inguinal ligament so that we can see this. I'm going to draw an inguinal ligament right here. So this is our inguinal ligament coming in. When it gets to the pubic tubercle, we started at ASIS, now we're at the pubic tubercle, it's kind of going to fan out. That portion, the fanned out portion, is called lacunar ligament. Lacunar ligament, fanning out. That's right here. I don't know why we care about it, but you might get tested on it. So there you go. Now, it's not done. It's going to do one more thing. The tip of the lacunar ligament is actually going to fold back on itself very thin, going like it came out this direction, you can imagine, then it fanned out, and now it is going back underneath the first part. Now, how do I know it's underneath? Because of what it's on when it's doing that. When it comes in, fans out here, turns around, and a portion of this ligament runs on that pectineal line. Remember that pectineal line I randomly mentioned for some reason? This was the reason. The pectineal ligament is a portion of the inguinal ligament. After it was lacunar ligament, now it is called pectineal ligament because it's on the pectineal line. Pectineal ligament, lacunar ligament, inguinal ligament, all really a part of the same structure, all continuous with one another, but we name them different things based on where they are. So that is what's going on with those ligaments. Last thing I'll mention with the lacunar ligament and the pectineal ligament is, imagine how hard those are to see. Here's what I will tell you from an anatomist perspective. Inguinal ligament, very deep. The portion of the inguinal ligament inside of the only area where I can see it, the superficial inguinal ring, when I'm looking in that opening, I can see lacunar ligament for sure. Can I see pectineal ligament? Absolutely not. Unless they cut through to show something that is directly on the bone that is covered up by other stuff. So in order to see a pectineal ligament, you have to see the pubic bone. So an easier way for someone to tag a pectineal ligament would be to take a skeleton per se, find my pubis, pubic symphysis, pubic tubercle, this ridge going back here, I would take a marker and I would mark on that ridge and ask you what structure is found here, something along those lines. That's how I think pectineal ligament gets tagged most commonly. So in part 2, we're going to dive into the inguinal canal, what it is, why it's there, and what's in it today. So we're going to cover some of that development that really helps it make sense. Thanks for watching, everybody. Don't forget to subscribe if you haven't. Like this video, leave comments, do what you will, or don't. It doesn't matter. I'm going to keep making them.